Gynecomastia is an increase in size of the male breast. And this it can be due to an excess fat tissue or an increase of the mammary gland, which in the men usually is small. If it is just an increase in fat tissue is an aesthetic matter, so it can be treated with liposuction or with if it is a very big breast with a mastopexy and a reduction like we do with the female breast. Otherwise, if it is just an increase in the gland, in the size of the gland, this has to be done with an incision and removing surgically the gland, and in case then doing the liposuction all around if there is fat. But the increasing of the gland, of the size of the gland, is considered not pathologic, but can bring problems like a breast, like a female breast, because if the male gland increases, it means that there is something that makes the gland increase. And so then this is not normal, so it is atypical. This can be due to in an older age, because there is an increase in the breast tissue also in the men. Can be a therapy with specific medicines, hormonal medicines, problems with the prostatic problems, prostate, and medicines that to cure these problems that can increase the size of the breast. Or there are also problems of other glands in young people, which makes the mammary gland increase. So there can be many reasons why the gland is increasing, so it's important to check and to treat this. The fat is just an aesthetic matter. So gynecomastia is diagnosed mainly with ultrasound. In fact, when somebody calls me that has this problem, before coming, I ask him to do an ultrasound, because the ultrasound can detect if it is fat or if it is gland. And then when we know what it is, we can decide how to approach. Like that is not a serious problem, it's more a problem, a man with a big breast sometimes doesn't feel comfortable putting a t-shirt or going to the seaside or something like that. It is a serious problem if the gland starts making problems, because there is also the male breast cancer, which is something more, even maybe sometimes is more severe than in the women, because men don't have enough a big tissue that can protect them. So gynecomastia like that is not a serious problem, but if the gland is big, can become a problem. Gynecomastia, if it is just fat and it is not so much, is enough to do a liposuction. Sometimes the breasts are very big, and if you do the liposuction, it will remain loose skin. So in that case, there is indication to do the mastopexy and the liposuction, so removing the skin, excess skin, and removing the fat. But of course, the scars will be different, because liposuction gives you two small cut of 3 millimeters. The mastopexy needs a scar around the areola, vertical, one in the fold, or even somebody does just one scar, horizontal scar, which crosses the nipple. So this is different. It's aesthetically not. If it is a gland problem, we have any way to cut. Usually it's enough to cut periareolar scar, so half areola, the inferior part usually, removing the gland. Always if there is not a big amount of skin. After that, you need a compression binder for at least 1 month, which allows the skin to retract and to settle everything. Well, if it is fat, usually are people who were fat before, then lose skin and lose fat and remain in the breast. So it's difficult without surgical treatment. If it is the gland is big, sometimes depending on the diagnosis of the reason why the gland is big, sometimes can be treated with some hormones, some drugs, but not so common. There are in some cases there is in some cases a possibility to treat the fat, the excess fat, with some injections of fat that dissolve the fat and it will be absorbed. But always if it is small, so with not so much skin on top. But the surgery is the best option anyway. Maybe in rare cases, but I would say no. Also because when somebody comes with gynecomastia, means that you can see the breast, the increase of breast, the size of the breast. So, and when you see it, it's already too big to treat it without surgery.